The case now is a 67 years old woman with a right colon lesion, described as an LST, but on the picture I saw there's probably cancer on the lesion, so we just have to check now this lesion. It's not really a good cleaning of the colon, so we'll have to wash. We are in the left sigmoid loop here. This is, I think, the left flexure. This is the transverse colon. We see the shape of the colon, and I think we are here at the right flexure. I'm in long scope position. There is a loop, so I have to unloop before finishing this colonoscopy. And the lesion should be here. So there is the right flexure. We see the lever there, but I'm not able to unloop here. So I'm forcing my loop, but then I will unloop. This is the right flexure, I hope. So I will use the little wheel and the big wheel to find my direction, which should be here. So this is the right colon. I see the cecum there. This is the ileocecal valve here at the 7 o'clock position. I want to reach the cecum, but there is still the loop here. So I will focus now on my lesion. I'm searching for it. It should be just at the right flexure. This is my cecum. I'm forcing on the loop. I will just check if there is nothing here. So I think the cecum is just clear, no lesion. I will switch to the TXE mode szép. This is the entrance of the ilium there. So the cecum is clear. So we come back to the right column. So we know that it is in the just the right flexure. The ileocecal valve is here. And our lesion is here. So it doesn't look neoplastic one. So I will inspect under salina. So we have to get out all the air before. And she's here at the so it's not a huge lesion. So of course we have two solutions now. We can do it with the simple and easiest one technique, which is under saline EMR. So I won't even inject, I will just try to catch it with a 20 maybe millimeter snare. I just want to shake again. And you see how it become really, it's not a really big one, maybe a 2 centimeter. So we try to put it at 5 o'clock position and see all the edges of my lesion. So once at 5 o'clock position, so it's GNet 2A, and I think we can catch it with a snare. It will take أعطيني 20 ملم also. So I will just try to catch it. So the purpose is the one block piece. So I'm just trying now to catch with 20 millimeter snare, and you see that all the lesion fits almost in the cap, which is 15 millimeter. So I'm not sure I will take it in one piece, but I will try. So I will put myself at the distal end of the lesion. So this is the distal end. Hello. So I fully opened my snare. I will try to lock it in the distal part like this and pull slowly until I see it like this. So this is the point of. So now I'm almost, distal part is okay. I have to be sure to have it all at the second. So I had it all. استنى شوية. I don't think we get it all here. We slept a little bit there. So we'll try. We push it there. So it's locked in the cap. We have to push it away. And we have to see our scare now. So we have maybe a little piece in the left part of the screen. My scare is really perfect. We have no perforation. We have just this maybe 5 millimeter. So we try to catch it with a 20 millimeter snare. حطي بيجة. حلي شوية بشوية. Stop easy. So I will just open a little bit my snare. I don't want to open a new snare, 10 millimeter, but if necessary, we will do it. So I have to be stable again. The polyp is just at 6 o'clock position here. I will push with my snare until I see my scare, which should be just here. So I will pull back slowly. And this is my lesion. حل شوي ترى. Stop. So it's perfect here at the second row. So we catch it here. ها ما نعرفك شنو نقول لك انا طب بغيت هذوما لي غومارك زايدين احنا كملنا سيطة فهمت شوف لي جات حاجة غادي هكا جات سي بون نحي البياجة. So we are at the end. I have just to shake now my scare here. So I see a little vessel there in the middle of my screen. I have to check the edges. That looks really perfect. أعطيني لونسة. So I will just put some soft coag on the edge here. نهد ما فما شيء غتلهي انا خاطر شوف تغزل لين تغزل غادي تعس عليها حل شوية 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 شوية. أبدأ سكتها. خرج شوية خرج شوية شوية باش نحرق راني خرج خبي خبي خليك هكا. البومب بربي علاش الخيط هكاكا محزوق هادي علاش مش ما يتحركش معايا اش بيه. تعرف هذا الكل راهو عندكم ساعة تحضروا في الصالة. So I will put less pressure on the irrigation. I will put some water here. If you want to do it under saline, you have to suck the air. So you have less water to put. And we go now to our scare. I will lock it with the cap. I don't want to see any air here. And this is the tip of my snare. And you see how it's burning slowly with the sink effect of the saline all around. So we have changed, can change our setting only by the difference here. So what I will do, I will use the the blue pedal. I have to put more liquid here. We have the air that is here. You see the submucosal layer here. And now I will coagulate here. And you see when I put irrigation, it looks like no effect. But when I stop irrigation and do it under water, under saline, this is a difference. يدك يا نهد يدك ما عرفش عطيلي عطاوله البيستوغي يمشي راهو. And we see in the middle of the screen this little vessel there. So I will just focus on it here. And why injecting, and we don't need really to put a lot of power in the cutting or in coagulation. So at this level, I think it's okay. أعطيني clip. So now come the last part of the procedure is the closing of this defect. We are in the right flexure. I don't have any perforation, but we have to close it. We see some fat there, but it's normal in the right column. So we will use the zip method. I will begin the 1 o'clock position. أي حل الكليب اللي بعده. It's almost 1 centimeter, 5.8 square. So we have to be careful while pushing the clip. حلي. So I will push it. دوري دوري دور على اليمين. خليك هيك. So this is my best position. So I want to put it like this. سكر برا. So the first clip done. The edges are now just one facing the other. I use my cap to push the first clip. I think we will need 3 or 4 clips maximum. And you see the advantage of putting the first clip outside the scale. حلة الكليب بتاعك. حلة. And now I will use my cap to push the stand, the clip. دور شوي دور. C'est bon كيكا. سكرتها. سكر برا. So the second clip deploy it. And I think the last one will be here. معاش استنى شوي حتى نزيدها شوية حتى نكملوها. حلي. دورة. دورة. زيد 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 زيد. So I will push slowly my scope. I see my defect there. I'm okay here. I just will suck a little bit water and you see the lesion will come front to me. سكر شوي ترى. حل. I want to grasp more tissue here. So I will push my scope. Suck a little bit. تو هكا تو ربي هكا تو. And when we suck the water, we see the lesion will come. سكر شوي ترى. سكر برا. So we will shake now. If we need maybe another clip, I don't think so, but we can put another one, but I don't think we have a place. And maybe between the number 2, number 3. So the problem is the insertion here. I have to push away the last one and put maybe a clip between these two one, but I don't think I will do it. It's enough. So now we have to suck all the water and retrieve our specimen, which should be just behind the scope. I don't want to leave some water inside. أعطيني أنس فروid أعطيني. هذا little polyp here. ولا هيت حتى بانس أعطيني بانس هيت. بانس بانس. لا هيت قلت لك 100 مرة كيف عندي انسترومون في يدي معناتها هي بيا أنا راهو مش بها هي راهو. تدخل في انسترومون تلهي بيا ما عندك حتى كلام معاها هي راهو. حل حل حل. سكروا حل ترى. حل. So here it is. سكرة. حل. سكرة. حل. سكرة. حل. سكرة. بشوية راه بشوية مش بيوبسي واحدة هي. سكرة. حل. سكرة. حل. سكرة. So we go again now to search for the specimen, which is here. Later. حلو حلو سكرة. So the specimen is here. We see the normal mucosa just there. So I think we have enough edge security, safety. So now we have to suck this water, this air, and in the same time inspect if there is something else here. نهدى أمانك ركز على مازال نخدموا راهو اللي تعمل فيه كله غلط راك كله غلط راهو موش فايقة بروحك راك يديك نظاف انت يديك نظاف ولا مش مسيته. So here we are in the rectum. So we'll catch all the air here, the water, and make last inspection. This is the anal verge here. I don't see anything, but we'll check again. أعطيني sans fixation. خلي غادي خلي. وين الطرف الأخرى اللي نحيناها؟ أعطيني شوية ضوء. يزك هاوكا. ريحة فرمول هني فما صبازات وحاجة خير. ليش في تحط في الضوء انت تحطه من فوق عشان هكا سي بون لي زيكزيو. يعني ترى في الضوء وينو بربي يا اخي وين قاعد تغزر تو انت؟ سكروا السي او 2 عليكم فوق. So it should be GNet 2A, connect 2A. My edges are okay on the endoscopic view. Even here we see some normal mucosa. And it's almost 2 centimeter size. انا تعرف والله والله ورحمة بابا مانيش فاهمك تغزر لي يديك تتفرج وهذا الشيء مش حتى تعاوني زح توا زز غادي شوية. So almost 3 centimeter size.